Okay, so I think we'll go ahead and get started. Welcome everybody to this Doug in a Doc. We are super excited for you to join us today. I think everybody's already muted, so just housekeeping. If you stay muted while the speakers are speaking, and then we'll have everybody unmute for the questions. So I know that there's a lot of new information out today, so I think we're just going to jump in and let Doug talk about all of the great things that are happening. Oh, Doug, oh, there you go.
I just had a phone call, sorry. I apologize for my casual attire today. I'm actually off today planting my vegetable garden, so it's a nice day to be doing that. Hope everybody's having a good day. Let me talk briefly about what's happening within Genesis, and then also I'll give a little bit of a COVID update. And like Anilka said, you know, we have a CDC guidelines update as well. So first of all, we're very excited to be recognized for the second time as a top 15 health system, Genesis Health System. This is by IBM Watson, and IBM Watson has 10 different factors that they rate all 350 health systems across the country. They choose 5 large, 5 medium, and 5 small. And we're in the small category because we're less than $800 million in revenue. And so we won last year, and we also got recognized again just a couple of weeks ago this year. So it's a tribute to all of our physicians, staff, and everyone based on the high quality. There's indicators that are patient satisfaction, quality, safety, as well as cost effectiveness for Medicare patients. Next, I would mention that we have a joint venture with Wesley Life. It's called WellSpire. We have all of our senior services together with them. That's been a very successful joint venture so far. It's about 2 years old. And we were just at a groundbreaking earlier this week in DeWitt for the Fieldstone project, which is a very exciting, the replacement of West Wing, but also the expansion into assisted living, and then also in senior housing. So that's an exciting project. If you live in Bettendorf, you've probably seen the Summit project, which is getting built, and a pretty big campus, actually, 100 plus assisted living apartments there, or not assisted living, senior housing apartments. So that is going to be opening up its first phase in July. We're excited about that. I would mention also Silvus is kind of in the middle, well, kind of on the front end, but close to the middle of its $20 million investment in replacement of things like the operating rooms and other upgrades. And so that's been a long time coming. The Silvus campus was built in the 60s and has not seen a lot of major investment, so we're excited about that investment. Jackson County, I mentioned last time we had this, is into their new hospital, and that's a great project. The replacement of that hospital, which was built, most of it was built in the 50s. One thing you may be interested in, we've had a lot of change in our volumes over the last 15 months since COVID started, and we are pretty close to our pre-COVID volume, which has been a long time coming and a very good thing. The only area that's still running a little bit behind is the emergency department and our convenient cares. But other than that, we're pretty much at our pre-COVID volume. Lastly, from a Genesis system update, I wanted to mention something I don't think I've mentioned before to this group, and that is we have a diversity, equity, and inclusion initiative. And we are working on this both with our employees as well as with the community. On the employee side, trying to become a more friendly culture to those, an inclusive culture from a diversity standpoint. And then in the community, we are looking particularly to attract, well, 2 initiatives there. One is about improving the health of the community in diverse populations. And there's dramatic disparities between different types of groups in cancer or in low birth weight. And so we're looking at what we can do about that. And we've done a lot of data analysis over the last year, and we know where we're going to focus. We're honing in on that right now. And then lastly, we're looking at improving our diversity within our professional job categories and having that reflect the community a little bit better. So that's just another project that I wanted everybody to be aware of. From a COVID standpoint, things certainly have slowed down, although they're not down to zero. And I think people forget that, particularly when things like loosening CDC guidelines happened yesterday. Today we have 24 positive patients in the hospital. Some of those are very sick within our ICUs. So 24 isn't zero. It isn't our high though. Our high was higher than 130 positive COVID patients from a census standpoint. We are seeing a dramatic shift in the age of those patients from the older patients being in the hospital to most of our patients now are under 50 that are in the hospital because 70% of the 65 plus population has been vaccinated. You may have heard also this week, there was an announcement, Dr. Leveridge may comment on this, that adolescents, let's call them, to the age of 12 can get vaccinated, and that's already started to happen at our max vaccination site. Speaking of vaccination, I would mention that we have seen a significant decrease in demand of the vaccine. We started vaccinating in mid-December. It's now essentially mid-May. That's quite a while, 5 months, actually 6 months. And the demand is probably about a third of our supply right now. So we have a lot more vaccine and we can get a lot more vaccine than we have demand. We don't even require appointments anymore at our centers. We're distributing vaccine now to our physician offices in many cases. And so we'd like to see that demand increase a little bit more because there's a lot of vaccine hesitant people out there. Lastly, I'll make a comment and share some data about the effectiveness of the vaccine that you may be interested in. So I mentioned we started vaccinating on December 15th. We were the first in the region to do that. Since that time through April 1, December 15th through April 1, we've had 617 COVID admissions, positive COVID patients who have come into the hospital and tested out positive. The question is, how good of a job is the vaccine done in preventing hospitalization? That's what it's designed for. It is designed to not prevent you from getting COVID. It's actually designed to prevent you from getting very sick with COVID and also being hospitalized with COVID. And of those 617 admissions, there are only 2 that had been fully vaccinated. That means they had their first dose and their second dose, and it was 14 days past their second dose. Only 2 patients. Both were in their 70s, both had a lot of other complications. And so that's pretty good because in the big studies, it was shown to be 95% effective approximately at preventing hospitalization. And we're running higher than that if 2 out of 617 were hospitalized. Now, the last thing that you may be interested in on that, what about people between their first and second dose? And how effective was the vaccine against that? Well, there were actually 20. So it's very important to get your second dose, as is shown by that statistic, because there were 20 that were partially vaccinated that were hospitalized, but only 2 who were actually fully vaccinated. With that, let me just introduce Dr. Shannon Leveridge. Dr. Leveridge is an OBGYN physician who is one of our superstar doctors within Genesis Health System. Dr. Leveridge was also recognized by her peers a couple of years ago, right, Dr. Leveridge, I think? You may want to come off mute now. As one of our outstanding physicians within the community. And she's been with us for some time. And we wanted to have her come on and talk about a few things related to the practice of OBGYN and also the impact of COVID. So Dr. Leveridge, why don't you take it away and then we'll answer any questions.
Sounds good. Well, thanks for inviting me and thanks to everyone who joined in and for the investment that people are having in the foundation. I know my husband and I are motivated by the work that the foundation is doing. And, we have 4 children in the Davenport Public Schools. And so every year when Genesis brings the flu shots into the public schools, it's just really, reassuring to me as a community member and someone who's very involved in my own community that we are putting the health of our community at the forefront. So as an OBGYN, COVID has obviously affected us in some ways. And we do find that pregnant women become more ill, are at higher risk of complications than non-pregnant women when they do get infected with COVID. So we've been, very communicative with our patients about taking precautions as we go. And now we're in the same boat as everyone else trying to confront vaccine hesitancy. The good news is although women weren't included in the original vaccine trials, last month they came out with data about 35,000 pregnant women who had received the mRNA vaccines and had not only good outcomes for the mothers without any signs of complications for the pregnancies, but we're finding that the babies are being born with what we call passive immunity. So those protective antibodies that moms are making in response to the vaccine are crossing the placenta. And so the newborns are starting life out with a little bit of COVID protection. So it just gives us one more reason to encourage the women in our clinics to seek out the vaccine, and we're really grateful to have such good access. We do sort of wish the access wasn't as good, because that would mean more people were getting their vaccine, I suppose. And I just, as a physician, I have found that every day in clinic, every patient I see, regardless of what they're coming in to see me for, it's easy to ask, hey, have you gotten your COVID vaccine? And I found that, maybe one, maybe two patients a day will come into the office thinking they're not going to get the COVID vaccine, or having some disinformation, or just thinking maybe they don't need it or they're not at risk, but they leave my office and choose to get the vaccine because they had that conversation with their physician. And so I think it's an important testament to just the trust that we build with our patients and the work that we can do as providers, as long as we're having those conversations and encouraging the community to join us in our efforts to get everybody vaccinated. So I'll talk a little bit about some other things going on in the OB world. And Doug had mentioned the issues of health disparities. And this is a very big topic in the OB world, and actually has been for several years now. You may have seen things, in the headlines about the increased risk of morbidity and mortality for Black women in pregnancy. It's 4 times that of white women. And it's something that ACOG, or the American College of Obstetrics and Gynecologists, has been very aware of and working on for years. And I serve as the Iowa section leader for ACOG, and spend time in DC every year. Of course, this past year it was on Zoom like this, but fighting to improve some of the laws and some of the regulatory things that can help us to improve outcomes for Black women. So as a state, we've been given a HRSA grant, about $10 million, and we're collaborating with Iowa Department of Public Health, the University of Iowa, and we are rolling out some initiatives to improve maternal health statewide. What's really exciting for me is that one of the programs we're doing, which is called AIM, is specific little bundles that are for safety for women on labor and delivery. And the whole state just this February started out that we've rolled this out now to the state. And Genesis is actually one of the flagship hospitals that we are modeling to other states, because Genesis has actually been enrolled in this program for years already. And now we're getting the whole state on board. Our quality and safety data at the birth center at Genesis is just fantastic. And it's wonderful that the University of Iowa leaders who are running this grant have looked to us and said, hey, can you be the role model to other community hospitals? So our safety nurse on labor and delivery, myself as a physician, and other members of the birth center are participating in these statewide initiatives to improve outcomes for moms and babies across the state. So I think that's, just an important testament to what we have already done. And I think that, as you brought up, the committee that we have on inequities and disparities is also a testament to the fact that we understand that we're not there yet as a health system or in our community, and that we see that there's a lot of work yet that we can do to improve outcomes for our patients who have multiple, socio economic factors, and these social determinants of health are really truly a big deal. And it's up to us to reach out to women and to work on those things.
Anything else, Dr. Leveridge? Okay, let's answer questions.
Questions, yeah.
Yeah, Anoka.
So I did have a couple of questions from some people that weren't able to be here today. And one of those, well, and actually I'm going to start out with a question I have, because I was looking at a Kaiser report from November of 2020, so pretty recently. And it was saying that there are 700 deaths per year in labor and delivery of moms. And that shocked me because I guess we don't really hear about that. We don't really think about that. And that 60% of those deaths are preventable. I was wondering if you could maybe speak to that, because that just shocks me that in the United States that we would have 700 women dying per year in labor and delivery.
Yeah, the numbers are pretty alarming. And actually, if you compare us to other countries, you would be even more alarmed at which countries we compare to in terms of our maternal mortality rates. And that is why ACOG has been making national efforts to turn things around. Preventable births, preventable deaths in moms often are linked to several distinct categories, such as hemorrhage. Okay, so heavy blood loss after delivery. And that is something that this AIM program I was talking about actually has a very specific safety bundle, so that if we identify early that a woman is experiencing a hemorrhage after delivery, there are many steps that we can take to prevent her from dying. And that's something that we've had in place at Genesis for many years now, and that we are now trying to roll out to smaller hospitals and to hospitals throughout the state that maybe haven't been using that evidence-based approach. And the data coming out of California, or the California Maternal Quality Care Collaborative, was astounding at the improvement that they had in their maternal mortality rates when they implemented some of these safety bundles, particularly around high blood pressure in pregnancy, around prevention of venous thromboembolism or blood clots that could form in the legs and go to the lungs, as well as around maternal bleeding. And so those are the three biggest ones. And we are sort of modeling, taking after their model here in Iowa to address the maternal deaths in Iowa. And we do have a committee that exists that reviews all maternal deaths and severe cases of morbidity in the state of Iowa, so that we can have that data and analyze where are we missing the opportunities to do better.
Awesome. So I have a little plug for the foundation too, and I'm just wondering how this fits into our great numbers at our birth center. I know that we previously had a what do you call it? A simulator, a birth simulator doll.
Mm-hmm.
And a couple of years ago, we had purchased a new one.
Yeah.
And I just wondered how that's being utilized, and if you think that has anything to do with some of our better numbers and better training.
Yeah, I think that is, I think it's a very big thing. So yeah, Noelle went on her way, and I think it's Victoria is our new simulator. It's actually part of the safety bundles that we were talking about, something that has evidence behind it that this is going to help us, is that, hemorrhage in particular, things like emergency C-section or various things that can come up emergently on labor and delivery, these things tend to happen more rarely. And so it may be a number of years before a nurse ever experiences this firsthand as the nurse taking care of the patient having the emergency. So having those simulations where, the nurses have to go through all the steps of what do we do first? What do we do next? What if this doesn't work? What if she's allergic to that? Having to run through those scenarios, even though you're using a model, it really helps you to start to develop that muscle memory that you need, the quick thinking that you need when an emergency is happening. And so, there's a lot of good evidence that doing simulation helps us sort of, kind of move ourselves a few years ahead, if you would, by getting more experience with something that, is a rare occurrence.
Awesome. I think I'm going to open up, see if anybody else has any questions. It looks like Dr. Rolfe, you might have a question.
Yes, directed to Doug. I think last week I heard that what I felt was only 65% of Genesis employees were fully vaccinated. Is that still the case? And if so, how will that impact CDC's encouragement to open things up? And what are your what are the hospital protocols for visitors? Do you have any?
Yeah, there are. Well, let's take the visitor question first. We do restrict visitors, and there are protocols for that, and everybody's still screened. And even with the CDC guidelines yesterday, you'll note that they made an exception for hospitals and healthcare. So we will continue to encourage wearing masks within the hospital, both for our employees and visitors. We've loosened somewhat who wears the N95 masks and where they need to wear them. So that's been loosened a little bit. Vaccination. So we have a history at Genesis of mandating vaccines. That is true for the flu vaccine. We were early in that mandate. I think a lot of healthcare systems have struggled with this issue. We're almost exactly the same percentage at Genesis as they are at Trinity. The number that I just got yesterday was 66%. It varies greatly by the job that you have and what your role is. It's about 95% with the doctors, and we think the other 5% got it from somewhere else. So my guess is the physicians are very close to 100%. It's about 90% with nurses and other professionals. It's very low with our support employees. So those individuals who have jobs within areas like housekeeping or maintenance or other areas like that. We are waiting, like other healthcare systems, for the CDC to take off the emergency use authorization and designate this vaccine as approved by the FDA. And then we, I think, as well as other healthcare systems, will move towards mandating the vaccine for our employees. We have done all the cajoling that we can to try to encourage people to get vaccinated. It just ends up being a personal choice. And for me, it's a disappointing number. I would have hoped we would have reached at least 75%, because that's where herd immunity starts to kick in. And we're just not there. So it surprises me a bit, but it's a struggle that we've had. Again, we've not mandated, and we've just tried to get the best information out from physicians and others to get people to have the facts rather than all the rumors that are on the internet.
How many hospital employees have tested positive?
Oh, it's a big number. And what's interesting, Dr. Rolfe, is that we track every single one of those, and we know how they, based on contract tracing, how they acquired COVID. It's over 640 who have tested positive out of about 6,000 employees. And all but about 10, if I remember the statistics right, contracted it outside of work, mostly from their own family members. Now, the 10 at work, we know for the most part, those 10 or so were contracted in lunchrooms and break rooms when people would take their masks off and were asymptomatic around others who then end up transmitting COVID to each other. We only know of one instance where a patient who had COVID may have transmitted it to an employee or vice versa. It's still a little bit unclear. That happened to be at Aledo. We know of no other instance where a caregiver was taking care of a positive COVID patient and contracted the disease. So we feel like we've done a great job of protecting people at work. However, it was at home and in the community that our employees then contracted COVID. Now, what's interesting to note is that the surge that we had from October 15th to December 15th is exactly where most of those cases occurred. In fact, it took us about 3 months to get our first employee case. And then when we were surging and taking care of 150 COVID census within the hospital, we had 150 employees out with COVID. So it was a double whammy because we were having struggles staffing the hospital with all the COVID patients there and all the emergencies. And that was exacerbated by the fact that we had so many employees out with COVID. So it was an issue of community transmission. I wish our employees would have been more careful in the community. We would have seen a lot less cases.
Thank you. Thank you.
Other questions?
Okay, I have another one. I'll go back to Dr. Leveridge, and this is about teen birth rates in our community. And what I was seeing is that those rates are higher in ethnic groups than they are in white groups, and that there's a lot of barriers for prenatal care in those groups. So the infant mortality is higher as well. Do we see that in our community?
So it's a very good question. I mean, it's a problem throughout. It's nationally a problem. I don't know the data locally, so I don't know it by the numbers. What I can say in terms of access is that I cannot imagine a community having better access than what we have. So my story, started with Genesis 7 years ago. I came to the community and took a position working at the Edgerton Women's Health Center when it was an independent nonprofit. And through some various turns of events, we ended up partnering with the community health care and Genesis to really bring this clinic up to scale to where we went from, I was the only employed physician to where we have 4 employed physicians. We have 3 midwives who are working here full time, and we don't turn anybody away. So access to care in this community is actually phenomenal, both for obstetric care, for contraceptive care. We can get women in same day for birth control. If teenagers need birth control, it's really easy to do here in the community. I'd actually love to see the numbers and see how we compare nationally, but access and having a great team that's just really sensitive to these social determinants of health, and having opportunities for transportation for patients, and now with telehealth too. I think we've even expanded our reach for obstetric and gynecologic care for women.
So I think that covers all the questions I had. What would you, for the people that are still on the fence about getting their COVID vaccine and are pregnant, what would you say?
Well, I talked to them about a couple of things. So one of the hesitancies that I hear is I'm going to get sick from the vaccine. And so that's just a little misinformation, and helping people to understand what it means, if you get a small fever after a vaccine, that's the mobilization of your, immune system, and that you're not actually getting COVID. So also, people will say, but it hasn't been studied in pregnant women. I have good data now to, tell them about tens of thousands of pregnant women and the outcomes that they've had. And most importantly, women who are afraid of the vaccine, you really have to talk to them about that, the risk of not being vaccinated. What we want to compare is getting the vaccine to not getting the vaccine. Mm-hmm. And not getting the vaccine puts women at very high risk for COVID. And we do know that people can die from COVID, and pregnant women in particular. As variants continue to emerge, we can expect that they will be back here, in America, that we will see COVID ongoing, and we've got to protect ourselves from that. So I really try to encourage women by really thinking about what their options are. It's not, am I going to be feeling a little under the weather for 36 hours from COVID, and that's the worst thing that's going to happen? No, the COVID vaccine, but the worst thing that could happen is that you could be terribly ill from COVID, and it could lead to an increased risk for preterm delivery, for growth problems with baby, for high blood pressure problems in pregnancy, or for stillbirth. And those are things that, women take very seriously because they want to protect their babies. So if we can help them see that by taking the COVID vaccine, it's not just about them, that it's also about their unborn baby, I think it helps to turn their mind around about participating in COVID vaccine.
The other comment I would make about that is this is people say, well, it's not been researched very much, right? The vaccine there was an acceleration of research. I just looked it up. 1.4 billion doses of the vaccine given worldwide. 1.4 billion. More than 200 million doses of the vaccine given in the United States. This is more research than is ever done on any vaccine. They do studies of 30,000 people initially. The number of doses that have been given with very, very minor complications, the J&J had the issue with the 6 40-year-olds, 40-year-old women. We're talking about minuscule complications when 200 plus million people have received doses of vaccine within the United States. So the safety of this vaccine and the effectiveness of this vaccine has been proven like no other vaccine in this quick of a time frame. Would you agree with that, Dr. Leveridge?
Oh, yeah.
Yeah.
It's very impressive.
1.4 billion doses worldwide.
My 12-year-old and my 15-year-old were just jumping up and down waiting to get their vaccines this week when the news came out that they were approved. So
I have another question. In view of this extended pandemic, have there been a significant number of home deliveries occurring with midwives, et cetera?
So I know a little bit about that. And we have seen some women move toward home delivery because of, I think one of the biggest concerns early on had been the restriction of visitors on the birth center. And so people who wanted to have multiple family members, present at birth, sometimes were choosing that. One good thing I will say about home births is that here at the work we do at the Edgerton Clinic, we actually have a collaboration with some of the home birth midwives because we know that some women will choose birth at home. And while ACOG, it doesn't support that because of the increased risk of neonatal and maternal morbidity and mortality, we think that having a collaboration is important. We have an arrangement with these home birth midwives where we say, listen, at any point in time in the labor process, after the baby's born, during the pregnancy, that something doesn't feel right to you or you're concerned, you can come to us. You can come into our birth center after you've been pushing for 6 hours. There will be no judgment. We just want to be there to take care of you. And I'll say several times a year, we do have women transfer in from home and, they call us on the way in and say, here's what's been going on. And it gives us the opportunity to help those women out. And so I think that the fact that we can remove that fear of judgment when women, when things aren't going well at home helps to keep these women just a bit safer.
Thank you. That's interesting, the collaboration. In 1962, I interned at Philadelphia General Hospital. And of the 1 month rotation on OB, 1 week I was assigned to home deliveries. And these would be in apartments primarily. And I would be accompanied by two uniformed officers would take me and a nurse and the equipment to this apartment and stand guard.
Wow.
That was a different time.
It was a different time.
I think we don't even think really of home births anymore. To me, when I think of delivering a baby, I think of going to the hospital.
There's a surprising number of women who birthed babies at home, isn't there, Dr. Leveridge?
There is, and in our community in particular, there's a small community of individuals. We seem to have a strong association with the chiropractic school.
Mm-hmm.
That there's some alternative thoughts about best practices for maternity care, and so we do have a subset of women from that community who choose that. And so again, it's nice to at least have that easy phone call for them when things aren't going the way that we wish they would go, that they can turn to us.
That's really exciting. I do have, we were talking earlier about getting information from social media and the discrepancies in the information. And I've heard one thing about women of reproductive age not wanting to get the vaccine because they've been told that it will affect their fertility. Can you speak to that?
Yeah, so there was actually some bench science that was specifically what I recall of this was very early on in COVID. It had to do with what COVID was binding to, which receptors it was binding to. And in particular, there was some evidence that there was strong binding in the testicles, and then it was presumed that there would be similar binding in the ovaries. But the reality is we don't have any data that affects people's fertility, because the COVID is binding strongly in many places, which is why people are having these multifocal or multi-organ system problems. It's not just pneumonia. And so that's not surprising for us. And we just don't have any data that's, good evidence that there's any effect on fertility. So unfortunately, I think the cart is before the horse in that regard.
Great. Well, does anybody else have any questions for Doug or Dr. Leveridge? If not, I think we're going to end just a couple minutes early. Thank you everyone for your time and your support, and we will see you next time.
I would just say thank you for doing this.
Mm-hmm. You're welcome.
Thank you very much, Doctor.
Thanks, Dr. Leveridge.
Yeah, thank you
Thank
for inviting
you.
me. Great.
Have a great weekend, everybody.